This morning, I'm going to be having a great conversation with Chris Pace, who's now at Searchstax. He used to be at Banner Health and other health systems in the past. And I'm really looking forward to having a conversation about how search is important to websites, how it's going to be evolving, and what his own experience has been and what he's seeing for the future. So, Chris, thanks for being part of the conversation. We can maybe start introing each other. Just give me a quick background of who you are, who you've been. A lot of people in the healthcare marketing sphere already know that, but just as a maybe 30-second blurb of who you are for anybody who might not know you already.
Yeah, so I am currently the VP of healthcare industry at a company called Searchstax, and what Searchstax does is kind of two things. One is manage solar implementations for different businesses, all verticals. And then there's another capability that I was actually a customer of, and I'll talk about where I came from, but it's called Site Search. And what that does is it empowers marketers to really own the customer journey and the search journey for their web visitors and hopefully conversion points. So prior to joining Searchstax just a couple of weeks ago, I was at Banner Health for about 7 years. And Banner is a large multi-state health system based in Phoenix, Arizona, which is where I live. And I owned the digital marketing strategy and team for that span of time. Prior to that, I was at Dignity Health, doing similar work there. I also worked in strategy at Dignity Health. So I've got this multi-decade sort of knowledge base of healthcare industry, how it sort of functions from a business standpoint. And then, the second half of my career has been really focused on driving consumers into points of care so that their healthcare needs can be met and our health systems can grow. And so that's what I'd be advocating for on behalf of Searchstax going forward, is really just showing how search can really drive and empower consumers into points of access and getting the care they need.
Perfect. Thanks, Chris. And for those who don't know me, I'm Brad Munch. I'm founder and CEO of Symmetris. We're a digital agency who focuses on maximizing the lifespan of healthcare websites. We've been around for over 2 decades. I've been in the digital space as well for several decades. So I'm looking forward to kind of sharing notes and how we've seen search just evolve over time and how it's relevant to specifically the hospital and health system website right now. But before we kind of delve into that, so you were mentioning, Chris, that you were more on the health system side, and now you're on, leading search in the healthcare sphere for Searchstax. What made you, make that transition? How do you see that as a continuity of the experience you've gained over the years, and how you're going to, help in that direction?
Yeah, so it started with a really successful project that I had initiated at Banner Health, where we partnered with Searchstax to improve our search capabilities on bannerhealth.com. We did a few projects. One was what I called OmniSearch, which essentially tied some disparate, pretty complex sources of information and made the search box be the unifier. And that was easy in some ways, like conceptually, because we've learned so much from Amazon and Netflix and Spotify that search powers navigation of content. And on bannerhealth.com, and a lot of hospital websites are like this, there's fragmented search opportunities. There's a doctor finder, and then there's a location finder, which is separate from the
Yep.
doctor finder because it might be another third-party platform.
Yeah.
Then you also have like classes and events that are really important to inspire and engage your community to understand their healthcare needs and explore what options your health system has. And that might be yet another platform. And there's never been an elegant way to stitch all of that together until Searchstax sort of entered the room and presented their site search capability. And I was hooked. I said, this is how it should be for every hospital, every health system. It makes navigation so much easier, and it mimics what people do most of the time. 80 to 90% of people are starting their healthcare journey on Google. So why are our websites not behaving the same way as the way that brought them in? And so when Searchstax approached me to open up this role and give me the opportunity to evangelize on this topic and connect with health systems and digital marketing leaders across our industry, I thought, wow, I can make an impact for more people's lives than in the community I serve doing this. So it's always been about, I mean, the entry into healthcare marketing and healthcare industry in general has been something that I didn't expect coming out of college, when I was studying business, but it has that extra meaning that is so powerful and so valuable and affects so many people's lives, that there's that altruistic thing that you just can't get in a lot of other industries.
Oh yeah, definitely. What I'm seeing is that it kind of you're increasing your reach in a sense where if you're helping Searchstax to help patients in multiple different states and health systems, your kind of impact is kind of just nationwide right now.
That's exactly right. And now more than ever, is it important for people in every community to be able to find and access affordable healthcare. And I do believe that the power of search is the way to get the right information and connect to the right care.
So I think that's kind of a good segue into kind of how do we approach and leverage search. And I think one of the issues that people have with search and that you mentioned, like a minute ago, was how it's fragmented and there's all kinds of these different places where you can search. I think that's one of those challenges. The other one, as you mentioned, was people are so used to Google, and Google seems to always understand what you're searching. And then when you get to these websites, it's clunky. If you don't type exactly the right word, it's not giving you the right page. I've seen what you've done on the Banner Health website. We've done a lot of implementations of Searchstax as well on our side. And the fact that it kind of brings all that together, and you can structure it by content type, recommend, other suggestions of things that people could be searching for, or even promoting some content. I think there's a lot of power to that. And I'm also going to want to, later on in the conversation, delve into the back end data and analytics that Searchstax gives you as a client, because you particularly are such a kind of a data nerd and you love to go into those stats. I think that's a really added value that a lot of implementations of search don't include, because when we're not implementing tools like this, we're customizing a solar search that's like out of the box for a client or something. We're always focusing on the algorithm and what the results are going to be giving, but we're not focusing as much on what's the insights you can, get out of what these people are searching and how you can leverage that. Right now, like, what do you feel, as opposed to what we were saying, the fragmented search, the fact that it doesn't seem to understand your queries? What are the things that you feel or that you've seen that are kind of quote unquote broken with search on hospital websites or healthcare system websites? But do you have any things that come to mind apart from those two?
Yeah, I think the biggest thing is, it feels as though it's an afterthought. And there's a lot of hospitals and health systems that have beautiful websites that are connected to the brand. They have great content. They have useful tools, but
Right.
connecting them is a challenge because you know budgets are tough to sort of triangulate on a big web transformation. So typically these initiatives are chunked down into projects, and even more so chunked down into what the vendor or the SaaS product offers. And Find a Doctor is a perfect example of that. A lot of it's super complicated to build a reliable inventory of physicians and all of the data that aligns to their practice, the
Mhm.
insurance types they accept, the specialties, crosswalking that against clinical versus consumer facing terms, you know, and then, you know, scheduling's a whole different bit that adds added complexity. And typically speaking, those find a provider or find a doctor experiences are housed in a off domain or subdomain
Right, like a separate
experience.
SaaS tool, yeah, right.
Yeah. And so when you're on brand page, trying to get to that is usually one click over and then another click into a search tool. But meanwhile, if you pick the search tool on the brand page, it is absent of knowledge of anything inside of that doctor finder. So that's the biggest example. And a lot of people that end up on your health system or health or hospital website are, you know, either looking to buy services or trying to understand some kind of customer service challenge they're facing, billing or filling out forms, those types of things.
Right.
And so they're forced to go outside of your website to use Google. Hopefully your SEO is linked up properly to Google so that the things that you intend to present to the consumer when they search those terms are actually showing up, and you're not, you know, missing the mark and potentially losing people that are looking for you but actually end up somewhere else. So, you know, this is the whole philosophy of getting, you know, a smarter search experience on your website that keeps people, you know, every visitor to your site is so important, and you don't want to lose them to friction. And I think, you know, if you can create an easy experience, then you're going to win loyalty.
And I mean, you're talking about the friction in that experience being the fact that it's like this other SaaS tool. You don't see it in the same searches, but just going to that other tool, I think, is adding another layer of friction where just the design and the experience of that third party tool that's going to be your doctor finder or whatever is usually very different from the actual hospital website. And so that just kind of adds another layer of, you know, is this the same site? Is this okay? Like, how do I, and so there's not only that friction of not finding those things in the same search result, but also my experience is changing every time I have to click on something. Same thing with, you know, the portal for the patient portal. That's another whole story, right? But I think it's challenging for today's, you know, patient to find themselves through these systems that seem to be not only fragmented on what data is in there, but also in the actual interaction with the interface, which is a bit different.
I want to drill on something that you brought up because it just made me think of the fact that, you know, we're all hit with, you know, potential phishing scams and all sorts of stuff all the time. And, you know, the one way you can grow your trust and credibility is having consistency. And, you know, when you brought up the point about inconsistent search experiences across these different products, that can erode trust and
100%.
potentially lose people. You know, folks that are shopping for healthcare usually are, you know, our age and older, not
Yeah.
Gen Z who can, you know, sniff out things a little bit more
Even and
effectively.
I've seen stats where they're less web savvy than we think they are, right? We kind of assume that they're so good
Yeah, they're
with the
more
web.
app driven. Yeah,
Yeah.
that's true. As folks are trying to navigate these web experiences, you know, having a consistent brand representation that you know who you're dealing with when you're on that site, you know, making it into one search experience just makes it all the more credible and reliable.
Yeah. And then I think that's the main currency, right, in the healthcare industry is that trust, right? It's, and just kind of,
Absolutely.
oh, it's sending me to another URL. Can I trust this URL, right? And just it's all these kind of small little things, but just add up to saying, you know, maybe finally I should maybe phone them up, right? Because I'm not too sure this is the real thing, right? And the more we can consolidate into one single URL, a consolidated search, I think is really the direction we need to go to maintain that consistency and that trust, because that at the end of the day is what's going to not only convert but retain those patients for a hospital or a health system.
That's exactly right. And you brought up just phone them up, and that makes me think of another piece of why having effective user experience and easy to use search is so important. Every time people just phone it up, that costs your health system money. And if you think about the volume of phone calls that come in, at our experience at Banner Health was it's a significant investment, and every phone call can cost $10, $20. And so if you have a misguided web visitor that gets frustrated and has to pick up the phone to call, not only are you risking losing the revenue from that encounter that would have been nailed down if the experience was easy, but you just cost yourself $10 to $20 to hear somebody vent about how frustrating the experience they had on their website was, and potentially lose a customer. So I think you have to look at it not just as a revenue generation capability, which it can be highly effective, but also as a cost saving strategy and call deflection strategy to help right size your call center operations to only focus on the things that are important to the system, and not because of a poor digital experience.
Yeah, I 100% agree on that, and it's kind of like a tangent or other conversation, but I think that when we're talking about the strategy around approaching websites, their evolution, or when there's redesigns, but we do a lot of kind of road mapping, like the next 2-3 years, what should be improving on, and oftentimes these projects don't really have clear KPIs of like, where am I trying to move the needle? And it's more like, oh, I don't feel the experience is good enough and this and that. But at the end of the day, if you can connect that to, hey, we've reduced this amount of calls to the call center, we've increased the conversion of X% on bookings and stuff like that. I think those are drivers that I think marketing teams need to focus a bit more on, and less kind of on overall kind of holistic assumed experience, and saying, well, what's this impacting on the business itself? But that's kind of like a side conversation. It's not necessarily what we're talking about today. So I just want to, before we kind of delve into how we can really maximize search, one thing that you mentioned a bit earlier, and I'm intrigued at seeing what's your perspective from being on the client side of, is you mentioned that, hey, search is often an afterthought. And strangely enough, right? Because a lot of, and I don't know if there's any stats you might have stashed that I don't have, but like, what's the percentage of people who do go onto healthcare or hospital websites and that kind of use the search? And I feel that it's a a, a a good percentage of people, right? Because these websites are so like there's so many sections, so many pages. The amount of content is huge, and so it's oftentimes easier to find what you're looking for by just typing it into the search than trying to find it in the menu to go to the right place. But at the same time, organizations are not focusing or prioritizing on that search, right? They're focusing on other stuff, or consolidating content and rethinking um, the menu or the design or this or that, or like, where are my call to actions. But and it's weird in a sense that search is an afterthought, since it's so crucial to getting the patient to the right place. Like, what's your thoughts on that, and do you have any insights on it?
Yeah. I mean, it's one of those things that you kind of forget you use, I believe, or
Maybe,
at
yeah.
least marketers forget. So the stats are kind of all over the place because, again, the fragmentation and the multiple ways to search things on websites is available. But anecdotally, from the bannerhealth.com perspective, roughly 70% of our traffic was using a search on our website
What?
of some sort.
70%?
Yeah,
That's
yeah,
huge. Oh
yeah.
my God.
And so, the primary search capability was like around 40%, somewhere in that neighborhood. But then you have, the separate find a doctor experience
Right.
that, still had its own search. You had, people looking for jobs. That's a completely different platform. I think it was Workday. So that's a whole different can of worms. But from consumer point of view, they they tend, particularly on mobile devices, you don't want to have to go through a mega menu. I mean, there's this whole philosophical divide between functional UI UX and elegant UI UX. And on mobile, the easiest way to do it is click that little magnifying glass, talk into your phone, and say, where can I find a primary care that's open tomorrow, and have a result generate from that, because that's what people do on Google. That's how they use their Siri and Alexa devices. I mean, that's how this all should work. And so I think we we believe, because it's easy to believe this, that
Yeah.
people come into this prescribed journey. They go on
Wow.
Google, they type in best orthopedic doctor, they land on your health system website on this beautiful designed orthopedics landing page, and then they click a button to book their appointment. And that is absolutely not at all. No one does that. That there's not one person on earth
That's
that
the
does that.
ideal kind of scenario. Yeah.
Right. So, the journey is like, it's loops and arrows and all sorts of stuff. And you brought up the fact that, your first step in project design is designing journeys. And I think that it is time for us to like reevaluate in our industry the actual journey. Listen to people, follow along, and watch them to see how they navigate your web experience, how they navigate care. A lot more of that investigation is going to be happening outside of your website, because Google's getting better. It's got Gemini AI search results that are taking up more than half the page now, and 80% of healthcare searches now have AI results in them. And that's up from 60% in January, and it was like 20 or 30% a year ago. So Google's dominating the investigation, top of funnel stuff for your journey now. So you better get it nailed down and really right. And what you designed even 5 years ago is antiquated today.
For sure. And man, we're going on so many different tangents here, but that's a whole other topic as well. I had this whole conversation about that. I think it was with Aaron Watkins a couple of weeks ago, and how we have to rethink how we're approaching websites. I mean, websites are not dead, right? Because there's a lot of kind of talk about, oh, this is the end of a website, right? But I think that we have to really approach it differently, and they're not so much about just generic, symptoms or whatever, and trying to get that SEO traffic, and it's more about that intent. But again, that's kind of a whole other tangent on that. So yeah, and so just to kind of get back to search, um, so so now we're kind of we're agreeing that search is a super important aspect to a website. It's been approached clunkily in the past, sometimes because implementing search on websites, and that's maybe one topic we didn't specifically talk about, but you know a lot of out of the box searches on different CMSs are really not don't provide really nice results and good results. So you have to do a lot of customization, and you got this Searchstax tool, which is kind of a almost as you plug and play it, it's way more valuable and efficient than something that's out of the box on a CMS. But how do we imagine a experience that does include search or that kind of journey? So it's someone would land on, obviously nobody's landing on the homepage anymore. Like there's a fraction of people who actually arrive at your hospital's homepage. They land on some other page through this Google search or whatever, and then they're going to use that search. And so what do we need to make sure is part of that search experience from the moment they're actually typing into that box, like like auto or suggesting, these are the
Yeah.
types of search other people have done, right, into that actual page where you're showing those results, and what types of results should you show, how that make that result page valuable to the user of that website.
Yeah. So I think one click before the actual experience, you need to make it easy and obvious to find. So,
That's a good
rather
point.
than being an afterthought of like, oh yeah, by the way, let's nudge the magnifying glass in the top right corner because that's what everybody does. I think what you need to do is be thoughtful and mindful in the beginning of where search has a role in the user's journey. So design around that capability first. And then when you start to dive into what job needs to be done in search, I think it's, you want to make sure that the person that is searching, number one, gets a result that's relevant. You don't want a high percentage of your users to have zero result searches. So, so first and foremost is making sure that the top 80% of use cases that come in through search are addressed with some form of content that's
Right.
relevant.
Right.
The second piece is, as you start journey mapping your users' experiences based on the different personas that are coming in, that's when you can start to land on the ways you facet your search results. And intent goes a long way as well, and that's where like a solution like Searchstax site search is really clutch, because as marketers, you should have a better understanding of your web visitors than anybody else in the organization. And understanding what their intent is when they search, and then tuning the site search capability to align its intent to the right call to action, so that you're reducing click depth
And
and
I just
getting
want
people.
to interrupt you 2 seconds here because
Yeah.
you're talking about faceted results, right? And that's
Yeah.
I think that's something that like you're saying that as a matter of fact kind of a thing, but a lot of these hospital websites don't actually have a faceted search. It's more of like a list of results that are all
That's
just links to pages.
yeah.
That is maybe looks a bit more like standard Google results, but they don't distinguish it by, oh, this is a doctor's profile, this is a location, this is a service line description, this is a whatever, and the ability to maybe filter for different ones. And so I think that's a really powerful way to help people interact with that search page, is to have those kind of categorizations and faceted items in that list, right?
Yeah, exactly. I mean, you think of the use case, pediatrician. I need a pediatrician near me. An antiquated search experience that's pretty typical on most health system websites will look at the content that's indexed inside of the content management system and surface up results based on the keywords that are in that statement.
Right.
And you might get primary care or pediatrician based forms that pop up to the top versus, like nowhere to be found will be a location or doctors, because that's on a separate
Because they're not there. Yeah,
tool.
exactly.
Yeah. And so, like with the faceted approach, just like Google, if you were to type that query into Google's search bar, then you would see, you know, ads, you'd see content about that topic, and then you'd probably get a local listing of
Yeah.
the pediatrician that's closest to you. That's how
Yeah.
your search experience should work, and that's what
Like a little
faceting
map. Yeah.
is.
Yeah.
Yeah, so the concept of faceting has been around for as long as search tools have existed, but getting it implemented on a hospital website with the disparity of different tools is not easy. And you need a unifier. And I think that's what Searchstax truly is it is a unification platform that takes complex data sets and puts them into the marketer's hands, so that they can design the experience and the results pages to align with your goals and objectives.
That's and so I think that's interesting because we have to bring that back to the idea of integrating search as a top level thing that you have to work on with when you're thinking about your website, and that results page I think becomes one of the important and crucial pages that you need to think about and need to design. Uh, and that has been that afterthought in most websites, because a lot of the conversation is about, oh, you have to design your service line page, you have to design your location page. But I don't often see like, oh, make sure you design your search results page. And I think that's something has to really bubble up much higher in the priority list than it is right now. These search pages, and I think maybe one of those reasons, as I was mentioning earlier, is that customizing a search page, tweaking the algorithm is really complicated on the development side of things, and understanding exactly what we want to because people have assumptions about what should appear on top, but actually programming that into the tool is difficult. And that's why we've relied more and more on tools like Searchstax that kind of have that included, kind of out of the box, have that intelligence that's, almost close to Google to provide those right results. Because customizing search is time consuming. That means, dollar consuming and time intensive. And so having a kind of a third party tool that integrates with the website, but that can also scan all the content that's related to your health system, I think is really, really, it's like a no-brainer in a sense, because it's not worth it to spend money to customize an algorithm and customize the programming behind that when tools can already do that. I back in the day, like I remember there was a story where we had the CEO of an organization that kind of typed his name into the search box and felt that his profile page didn't pop up high enough in the search results. And we spent something like 40K of programming work to tweak the algorithm to make sure that the results fit with what he wanted, kind of a thing. And for me, that's an example of you are completely off from what you're trying to achieve as a patient experience, as an organizational goal and stuff like that. And I feel that these tools that have that already built in, that we don't need to think about, you have the tools as a marketer to make those tweaks, fix it up. We're obviously going to help as an agency to make it fit with the style of the website, do, customizations that are required, but it just makes it such a lower cost and much higher value that I don't understand why people would manually customize their own search on their website anymore and not use these types of tools.
Yeah,
Um,
and that speed to market bit is so
oh,
important
for sure.
because, like, just as an example, we're in July right now, but in a couple months, flu season makes its appearance yet again in North America, and flu shot campaigns are super important, and every health system, every provider group does these things because it's important to keep our population healthy. But it's also something we don't make money on that. We don't make money on flu shots. Contrary to popular belief, no, health systems don't make money on flu shots. So the amount of investment that is allocated to flu shot campaigns is pretty much $0.
Hmm.
And your point about going to IT to implement some kind of promoted result in a standard out of the box search experience just so that flu shot results can pop to the top. um, no one's going to spend that money. They're going to
No.
come up with, janky ways to kind of work around it. And, that's where tools like Searchstack Site Search give the marketers the opportunity to create, custom anchored results in your search experience that can be implemented instantly and have zero IT lift because it's all inside of that headless container. And so, for teams like yours, Brad, you're designing those use cases without thinking of the actual campaign. You're designing that experience that can be rinsed and repeated in the future for all of those types of, sort of sentinel events that occur throughout the year. And so I think, again, just giving the marketers the power to not have to open a ticket. I mean, can you imagine not having to open a support ticket to do something and getting such a powerful capability right there in real time? It's super cool and wins a lot of credibility in your organization when you're able to do that.
Yeah, I 100% agree. We focus a lot on how do we give the marketing team autonomy to do this stuff, by themselves, kind of not having to depend on us as an agency. And, as you're mentioning, the time to market of just overall just implementing a search like this, but it allows you to say, hey, we need to have this, we want to drive this specific campaign, or we want to push this type of information. And we know that, as you were mentioning earlier, like maybe up to 70% of visitors are going to be using the search. Well, that's a great place to promote that information as a promoted result. You're basically being your own Google, where you have this promoted result in your search box, and so that's a good kind of added value again to that kind of tool. So
Yeah, it's almost fair to say that your search results page is your homepage. You know,
Almost. Yeah.
I mean, I remember bannerhealth.com, there was all this energy, or I guess from, the powers above us in the ivory tower that, wanted the homepage to be dialed into certain things. And you look at the web traffic stats, it's less than 10% of the
That's
total
it.
traffic are going to the homepage. It's mostly people in the building that you work in that are
Yeah.
doing that. So, making it, again, it's that old adage of meeting people where they are. And if they are in the search results, then use that as an opportunity to drive home the initiatives you want to drive and get people to the access they need.
So yeah, like, I'm trying to see how just the kind of the next step that I wanted to kind of explore with you a little bit about this kind of search being this kind of hub where a lot of people are going to be going to. That means a large amount of traffic, right, of the website, or a significant amount of it is going to flow through the search page, which, as you mentioned, is kind of the de facto, in a sense, homepage. And we were mentioning earlier how you love to uh, go through that data, understand what's happening, get some insights out of there, and some actionable next steps to improve on the website. So,
Mm-hmm.
what are, from your perspective as a healthcare marketer, but also now that you have maybe a potentially more insight on what's available to tools like Searchstax, now that you're on their side, like what are the main things you're looking at, and how are you going to be leveraging that in regards to your search, which is, I feel this is kind of it's not an uncharted terrain, but it is the less beaten path that has so many kind of gold nuggets along it that people are not using. And you've had that experience, and it doesn't need to be, and maybe it's long-winded, but since this type of tool is so easy to implement on a website, and it's cost effective, it's not out of reach of a more kind of regional kind of hospital, or smaller health system, which oftentimes is, oh well, these larger systems, oh, they can get all this kind of CDP installed and stuff like that. But implementing a search and getting insights and data out of it is not prohibitive, and it's so valuable. So what do you say has been the most interesting nuggets you've gotten out of that?
Yeah, so I think, just top line, and it's kind of like the everything's old is new again kind of thing. So, search was big 20 years ago, trying to figure it out, and now it's back again in a new flavor.
Right.
Um, you know, Web transformations are really hard to do at large organizations, and a lot of times, what you have can work with just a reimagination. And I think that that's where, like a tool like Searchstacks came in really handy for us at Banner Health. We had gone through a big transformative web redevelopment project 2018 to 2020, spent a lot of money on getting Sitecore stood up and really rethinking the user experience. And search was not top of mind in that design. And so in 2021, 2022, we looked at it and said, hey, this is complicated. We need to find a way to unify it. And so a tool like Searchstacks is very reasonably priced. It didn't require I mean, it didn't even have to go through like normal capital investment process. It's very reasonable to purchase and implement. And because it's headless, it can sit inside of your design system really elegantly and out
Mhm.
of the box if you want, or you can customize it if you want. And so that, I think that's the key point of implementing a tool like this, is you can reinvigorate what you've already spent a lot of time and energy on and improve that experience very quickly. These deployments can be weeks to lay out. And so coming back to, your question about, what are you looking for and how do you use tools like this to
Right, the data, like really in the data layer, like in
in
the
the
back
data.
end, the
Yeah.
insights, right? Like what I've often heard clients say using the search stacks and other types of tools is, hey, you know what? Now I know what are the top search queries that people are asking, and I can create content around that, or I
Yep.
can see things that are landing on pages that we don't have content, or questions that are creating that don't have content for that we should be creating because there is a demand for this. Like, what's the use you've done of getting that back end data of how people are actually using the search?
Yeah, I think there's two very important elements to the analytics that uh, marketers will love to be able to leverage. The first is zero result searches. You can look through that data really simply. You can offload it into a BI tool or just use the built-in analytics capability and drill down on themes. And maybe there are searches that are looking for something that ties to an organizational initiative and a growth strategy. But because of the way people are searching for those things, it's not surfacing up results. And so with that, you're able to build a content strategy against those zero search results. And that's been really important for orgs like Banner, who are really trying to be the trusted resource for all of the folks in our community. And if consumers are looking, that means they trust you and they rely on you for information. And so it's almost like an obligation to be able to present that content. So it's a content marketer's dream to have those insights. I think the second piece is looking at the top searched results, as you mentioned, and really, if let's say 20% of your traffic is coming in looking for information about hip and knee replacement. Well, all of a sudden, you've just uncovered demand. And
Right.
so, using that, working with your strategy team, with your care teams, operations to look at, you know, is there availability? Is there, like, are the searches coming from locations where we have maybe less of a footprint? And so how do we use that strategically, that information to redesign a care pathway for folks they clearly want your services because they're on your website and they are looking for the care. So is your organization ready to capitalize on that demand that is exposed in these analytics?
Yeah, that's actually really powerful in the sense where, oftentimes the conversations around this are focused a bit more on the actual marketing team. But if you're able to surface this type of insight on the overall demand in a specific area, now you're impacting, operations, you're impacting the growth path of the overall organization. And so I think that's really interesting to kind of make marketing more valuable and perceived as more of a key player, right, in the overall organization. Like we're slowly running out of time, and like this conversation is super interesting. We didn't even get into like how AI can impact search. Like I know that Searchstax has an AI component to it, and there's a whole evolution of people were using chatbots for a while, like the new kind of thing with the LLMs. But I feel that there's some kind of there's a merging of chatbot and search bot and how that all works together. But maybe that's a conversation for another time. Uh, I'd love to kind of conclude our conversation on what would be the best next steps, right, for a healthcare marketer today to say, okay, well, I understand search is an important thing, right? What should be the things that are low hanging fruits that I should be looking at, or what's my next steps that I should be doing, like as an actionable takeaway, based on the conversation we just had? Do you have any things that come to mind immediately?
Yeah, yeah. I think first is let's size the problem, how
Mm,
or the opportunity. How many people are actually using search on your website? If you don't know the answer, it's time to reevaluate things. So that's the first. That's the first bit, right?
yeah.
If you do know the answer, then and you didn't have to put in a ticket to IT to get to that answer, then you're probably better than average, which is good. But
So
but
pat yourself on the back. That's good. Yeah.
yeah, that's right. Pat yourself on the back. But I think it's really, think of yourself as your customer inside of your search experience and determine are the are these, top use cases uh the intended result? forget about the landing pages for a second, forget about your menu of navigation. It's really important to focus on the the way people are using your tool and identifying that, is there any friction in our current design? And I guarantee there probably is. And so that opens up the door of, well, can I, in my current search experience, make changes for the better, for our users that are visiting our site, and do that without an IT ticket. And if you as a marketer do not have control of your search experience directly, I think it's time to have a conversation about what would need to be true to improve it. And you know, I'm happy to have conversations with people just to talk strategically about that. And whether it's Searchstax or another tool, I mean, I think that there's a lot of options out there, but you need to have that power, because it is such an important capability.
Yeah, 100. I definitely agree with that. And I think maybe from my perspective, a takeaway that I'd see is, if as a healthcare marketer and in your roadmap over the next year or so, you had a bunch of priorities, like, is one of those related to search? And if it's not, is there one that could be bumped off and kind of bring in search? Because it's such it's like a blind spot that people have, but that it's such an important aspect to making sure the website is relevant to patients. So yeah, I think it would be like at least over the next 6 to 12 months, you should have one type of initiative to think about how are we approaching search? Are we leveraging it correctly, or at least thinking about it? I think that would be my takeaway. So
Great.
Chris, this was fantastic. Thanks for taking the time to talk to me about search and how it's impacting websites today and in the future. Uh, People can find you, I guess, on LinkedIn or through Searchstax directly. And if anybody wants to reach out to Symmetrix or myself, you can do it on LinkedIn as well or on my website. Thank you so much, and looking forward to an upcoming conversation.